Hi there, and good afternoon. Welcome to Canceling COVID. It's real talk, and we bring you real solutions to real problems that COVID creates in our neighborhoods and our communities, especially in communities of color. Now, today, a major warning to wake you up, or just to wake up and pay attention to, it's to prevent a fourth COVID-19 surge. There's a lot of talk on leading health experts say increased vaccinations are slowing the virus, but they worry that Americans may get too slack with social distancing and mask wearing, and of course, the other safety restrictions that have been in place that would help ease where we've gotten to today. And they're already preparing for a spike over spring break, very similar to what we saw over the Christmas holidays and, of course, after Thanksgiving as well. That brings us to the question of the day. How can we safely travel during a pandemic? I'm just curious. I know you're itching to get out, and cabin fever is real. But let's talk about this. I'll be looking for your responses as you hop on and join the conversation. Let me know if you feel like we can safely travel during a pandemic. And there are people that are, traveling right now. But as a whole, we know that air travel rather, is down. So answer the question of the day. I see Travis Rivens has hopped on already. Good afternoon. Let us know, Miss Travis, can we safely travel during a pandemic? I'd love to know your thoughts. We can't be any safe traveling without testing, and I know some airlines have started to incorporate this method. But what if we told you that you could test for COVID that is, from the comforts of your home and get your results in as quickly as 24 hours? Well, I have someone that can share this information with you, and it's none other than Global Village Health. I've got two special guests who are here to join me to talk about it. They'll help me with their last names. I know them as David and David. Dopoku and Denquay, I believe, if I'm pronouncing that correctly. But they're representatives from Global Village Health here in Charlotte. And we were having a little bit of connection problems, but I thought that David had gotten on. They were going to talk to us about the opportunity to test from the convenience and comfort of your home and get the results back to you within 24 hours, guaranteed 24 to 36 hours. So as we're looking to bring them up and talk about this new method, it's really interesting even to see how people are getting creative and have been able to bring on all of these different avenues that we are able to just expand, increase regular testing, especially one of the things that has been identified in our community that's sorely needed. So David is telling me that he's here, and my producer, I think they're trying to connect here. So hopefully we can get those guys connected and get them on board. I'm not sure if there's some IT issues going on, but again, Global Village Health, they've got a brand new concept, and we wanted to talk with them about that. In addition to that, we also wanted to talk with Will, and we're going to go ahead then and move on to our next guest. How about William Campbell of First Care Medical Clinic around the city with several locations? William, thank you for taking the time to talk with us.
Well, thanks for having us. I appreciate it.
Absolutely. So First Care Medical Clinic is no stranger. Has been a big supporter of all that I've done in the community, and I'm quite appreciative of that. You're now their PIO, and congratulations for taking on such an awesome job. Let's talk about what First Care Medical Clinic is doing. Dr. Quara, who had been on the show before, kind of educating our viewers and listeners about what to expect with COVID and made recommendations to take the vaccine. Kind of tell us what the doctors are doing to educate and maintain open dialogue with patients about COVID prevention. What is happening right now?
Absolutely. So we have seen the influx, of course, with testing right around the holidays. We're seeing that start to increase now, as well as people are wanting to do all of the things that they want to do. But we also see, in addition to being a testing center, First Care Medical Clinic is a combination between urgent care and primary care. So I'd say a bulk of our patients are primary care patients that we see on a regular basis to attend to their ongoing needs, the chronic conditions, or just their basic family doctor. And so, we're taking the opportunity that all of our providers, when they are seeing a patient, whether they are a regular patient that we see every 3 months or every 6 months, or there's someone that came in for a urgent care issue, we're saying, make sure you are doing what you have to do to keep yourself safe in the pandemic. limit your essential travel, masking, social distancing, washing your hands. So we are educating all of our patients over and over again. And then for our patients who come in for testing, as well as our patients, our regular patients, we're informing them that we are gearing up to be a vaccination location clinic in the very any day now future. So we're talking to them about the importance. We're trying to actually work with them to dispel some of those rumors about the vaccine or why they might feel uneasy, because we are definitely seeing, especially in several different groups that have a low instance of going to get the vaccine. And it's just because they just need to be educated to talk about, what is really going on, where did it really come from, and really reassuring them that the vaccine is safe. And I think that
Oh,
information
well,
coming from their family doctor is a
right.
lot better than just what they're seeing on TV.
Absolutely. And First Care Medical Clinic, I consider your one-stop shop.
Yes. Did I lose you?
It allows you to have a lot of confidence in the service that you're receiving. So we're going to get to the vaccine piece, but let's talk about the COVID testing that you're doing right now. You're doing antigen and antibody testing. And if that's the case, then what's the difference in the two?
Sure. So a lot of people think they go to the COVID test, they want the rapid test,
Mhm.
which is where they get those results in 15 minutes. And that is your antigen test. And that's going to look for an active COVID infection. So if you suspect that you've been exposed, if you are showing and presenting symptoms, that is what you're going to want to get. And that's going to show an active COVID testing. Antibody is a little bit more involved, and it takes a little bit of time to get those results. For us, the turnaround time with the lab is 3 to 5 days. It's usually on the shorter side right now, which is a good thing. But that's going to look a lot deeper to see whether or not that you have the COVID antibodies, which is sign that either you had the infection or that you've been cleared, that you've developed the antibodies and the infection is over, and you don't have COVID. So what we tell people is if you get the antibody test and you suspect that you had an infection, from 14 days afterwards, and you have those antibodies, you are clear, and that you have gone over that COVID hurdle per se, and that takes a little bit longer. So the biggest difference is when it comes to, for most people, the antigen test is going to be what they need. That's going to give them the answer that they need. But if there's some iffiness about the results, let's say that you had the exposure and that you are symptomatic and that comes back negative, your provider may actually say, well, let's do an antibody test just to be certain, to
And
get
that's
the
a
full picture.
right. And First Care has several locations around the city. Monroe, I know the Plaza and Nations Ford. Where are the other locations?
Yeah, we're down in Rock Hill, South Carolina. We're out in Gastonia. And then we have our location in Albemarle out on the east side of town. And next month, sometime in November, we're opening a seventh location. We're reopening our Locust location to service those populations as well.
Yeah, First Care Medical has been in the clinic, in the community for years, doing great work in the community. And you had kind of mentioned the whole vaccine. I wanted to build to that, and I may have led you by jumping
That's
ahead
all right.
as well. But what type of conversation is the doctor having right now and educating patients about preparing for COVID prevention, but also preparing for the vaccine?
It really just starts with the provider asking the simple question, are you planning to get vaccinated? And if they answer yes, then we say that's great. We give that not necessarily positive reinforcement, but we get excited for them and we say, well, we will be providing the vaccine shortly, as soon as we get the shipments and everything that's there. But if they say no, then we start to ask the questions why. And for some people, it's just it could be a multitude of reasons: religion, faith. It could be an allergy. They think they might have an allergy to components of the vaccine which are found in like a flu shot or other vaccines which aren't necessarily in the COVID vaccines that we have. Then others, it just comes down to misinformation, that they just don't trust what they see. They're following whatever they might see on social media, or they're talking to people, but they're not having that conversation with the provider. So, when they tell us no, our providers are really doing that deep dive to find out why and try to calm their fears and say, it really is in your best interest, especially for some of our patients we've been seeing for 10, 15, 20 years. So we say, it's in your best interest that yes, you need to get this vaccine. That no, it's not something that came up overnight. That there was a long history before COVID-19 was a thing. And it is completely safe, and we work to really inform and educate so that they feel more confident when their turn is up to get the vaccine.
So, any idea when you guys will be ready or prepared to start doing vaccinations? Of course, I know the whole supply right now is a little slow. The demand has certainly exceeded that. So, any thoughts or ideas of when you guys will start?
Yeah, so we've been actually working with AHEC, which is the American Healthcare Education Centers, and they do all the training. They prep providers like us to be able to administer the vaccine, and they do all of the continuing education for providers. So we have a really good relationship with them. So we've been working with them to make sure all of our staff is trained, and then we've been working to upgrade our facilities to make sure that we can accommodate that vaccine shipment. For us as a private provider, we have just now come to, it's our turn that vaccine is becoming more available. They're going to be reaching out to your home doctor, your private providers to help with the vaccine. So we're just waiting on that. We anticipated it happening with phase 3, which we just recently entered into 2 weeks ago, about a week ago.
Yeah.
But they are prioritizing because that volume of vaccine still isn't there yet. They're prioritizing education workers first. But then on March 10th, when it opens up to all essential frontline workers, that's when we really anticipate that we're going to have that volume of vaccine, that they're going to need to reach out to us. So we are ready. We have our infrastructure in place on the back end. We have our technology processes ready. It's been tested. I've been working on that. Everyone is ready. They know how to do the shot. We know the logistics of the thaw time and how long we have once the vaccine has been thawed. So we're ready to start helping getting those shots in arms,
So,
and that call could come any day
any
now.
day, and I know plenty of people are waiting. So we're gonna wrap things up. Our question of the day: how can we safely travel during a pandemic? I want your input, but I also want to look at some of our comments. Joe Lowry says, "No, stay home." Travis Ryven says, "Don't think we can yet. Numbers are still too high." Hi to Anna Louise Parr Gates, who just hopped on, as well as Altavia Jones. Thank you. So glad to see you as well. Rob Ferguson, hopping on. Boy, it's been a long time. He's from the DC. The DMV area, as a matter of fact. And G Man says, looking good and sounding great. So, Will, I love your thoughts on that. What do you say? Is it too soon for us to start traveling, and can we do it safely?
I think if you absolutely must travel, you can do it safely. You need to take the extra precautions. But if you don't have a burning reason for work, or you need to visit a funeral. I hate to say that
Right.
way, but unless you have a really true reason to travel, just don't. But if you do, definitely mask. They've shown that air travel is safe. It's not the air travel that's the problem. It is literally going through that airport. So
Right.
something that you can do to minimize your risk is to try and book the most off time you can, so the airport is going to be less busy. That's going to reduce some exposure in the airports. Carry your sanitizer, carry everything. It's better if you can just drive, because you're going to be in your own quarantine bubble in your car.
Right.
But unless you absolutely need to travel, I would hold off, a little bit longer until more people get vaccinated, and even you at least get the first dose yourself.
And Will, I appreciate you taking the time to talk with us. And when you talked about the airport, yeah, that's got to be like a cesspool of germs from the time you get out of your car, get through security, and all the different things you're touching, as well as if you got to go to the bathroom. It's just a whole lot happening there. So thank you again. Firstcarecanhelp.com, 704-654-8511. Dear friends of the show, and William, I really appreciate you taking the time this afternoon. We'll talk to you again on Sunday on Sounds of Inspiration. But thank you, and say hello to Dr. O and Dr. A for us.
I will. Thank you, Tanya.
Absolutely. So we're a real good conversation. They are preparing to get some vaccines, and we're talking about First Care Medical Clinic. I've been in the community for at least 20 years with several locations, and they are doing testing there. You can go to all of their locations. And as we were talking, as we started the top of the hour, there's an opportunity now for you to do testing in the comfort of your home and get the results within 24 to 36 hours. We're talking about Global Village Health. I believe we have David. We were kind of not connecting early. I'd like to bring him in and talk because we love giving you information, real talk conversation. And there you go, David. So glad to see you. I've talked to you several times, so I get to put a face with the voice as we talk about Global Village Health. He was here, and looks like I don't see him now. I know technically he was the call was dropping. It seems like on Fridays we start to have these issues. While we're trying to get to that, guys, tell me your thoughts for the question of the day. Do you think we can safely travel during a pandemic? Are you comfortable skipping out on town? How do you feel about this? Or how do you safely travel during a pandemic, especially if you're doing air travel? There's a lot to take into consideration. And if you've got your whole family that you're bringing along, there's a whole lot that you have to take into consideration. I see V. Norris Long has hopped on. So good afternoon. Thank you. Hey guys, weigh in. Let me know the question of the day as we work to get a Global Village Health back up on the line. I know Miss Amelia is working really hard to get this worked out. And while she's doing that, let's kind of look at some of the headlines and get caught up. On yesterday, of course, we heard from Governor Cooper, and it happens today. We are moving a step closer to getting a third COVID-19 vaccine. This is not to go Governor Cooper bit, forgive me. North Carolina statewide 10 p.m. curfew is what Governor Cooper has ended, and that happens today. Bars and restaurants will also be allowed to sell alcohol until 11 p.m. In addition, clubs, gyms, theaters, and many other businesses will be allowed to operate at 35% capacity. And Lord, my heart goes out to the businesses because it's been tough being in business during COVID, and they've lost so much. And so that's really, really difficult. So here we are, the curfew now being lifted. Great to see that happening. Governor Cooper also eased the restrictions because key COVID metrics, like the number of new cases and hospital stays, well, they've dropped. Also, excuse me, happening today, the U.S. moves a step closer to getting a third COVID-19 vaccine. The FDA meets today to discuss an emergency authorization of the Johnson & Johnson one-shot vaccine, and the committee has already said the shot is both effective and safe. So that's good news to hear as well. You know, the main talk for a lot of people right now is about the variant that's out. So many people in the medical field having a lot of conversation about that. And, you know, some people are saying, you know, kind of like, is it when you get one problem solved, then you got another, as long as these variants keep occurring. And of course, I've heard that when it comes to a virus, that's to be expected. So many of us are looking forward to the vaccine to come. And I've got Global Village Health back again. So David, thank you so much
So,
as we shift gears
thank
and
you.
try to hold this conversation with David. Hey, thank you for joining us.
Thank you. Thank you. Third time's a charm. We've
Absolutely.
had some connection issues.
Well, David, I know
Can you hear me?
I can hear you fine, and we don't have the best connection, but I want you to have an opportunity to talk about Global Village Health. Tell us a little bit about the concept.
Yeah, absolutely. So at Global Village Health, we believe in delivering COVID-19 test results in the shortest possible time. And when you think about it, it makes a lot of sense, right? You get a COVID test, your clinical picture is always changing. And so our philosophy is get the test results ASAP. And for us, we think 24 to 36 hours is the sweet spot. 24 to 36 hours later, not much is probably going to change. Some of our competitors are doing 2 to 4 days, and that's fine. But remember, the test result just gives you an update where you are at a point in time. And so when you shorten the turnaround time, your results are going to be more indicative of what really is a situation. And that's really the concept behind it. And for us, we are targeting travelers, people who really need to look at their results in real time. And that's the goal of Global Village Health, is to deliver your status in real time.
Well, I like the idea of home testing though, because especially people who are limited when it comes to transportation and they're not, they're not able to get out and not as mobile. So how did that come about?
Yeah, no, that's a good question. it, you know, this was a pain point out of a personal experience. Me and my business partner were traveling, and we had to change our flights and our schedules so many times because we couldn't get in that 72-hour window. And so to us, it just made sense that this is a huge opportunity to service people who have time sensitive results. I mean, most people traveling, it's 72 hours, but you have countries like Germany where you need your results within 48 hours. And if you go to some of the bigger companies, they're telling you 2 to 4 days. And it's like, well, I've taken time off work. And if I don't get my test results, I got to take more time. There's a lot of inconvenience that comes with getting your test results late. And so we knew just from our personal experience that other people are probably experiencing the same thing. And lo and behold, that when we got started, we were able to confirm that it's a major problem. Just having the certainty that your results are going to be there, so that you can see your loved ones, or just knowing that you're good at a point in time.
Especially, I can imagine if you're doing international travel, that can be a real problem.
Yeah, it's a big deal for international travel. I think the requirements are very stringent, and it depends on the country. Like I said, some countries require a 48-hour turnaround, but the 72-hour is standard. And most of the countries require you to take a PCR test. I know your guest was talking about the different types of tests, the antigen, the antibody. Most of that won't satisfy international travel. And so our at-home test gives you the gold standard of testing in the convenience of your own home.
Well, we've got scrolling across the bottom of where you are currently testing from 8 until 3. Looks like you're in the Still Creek area as well as the Harrisburg area. How important would you say testing is, and how often do you recommend people get tested?
That's an excellent question. It really depends on, I kind of look at everything in terms of your personal risk factors, right? So you have some people who are working jobs where they're naturally more exposed than others. So you've got your frontline workers, you've got, people working in the grocery stores. We would recommend people in those types of professions to probably get tested once or twice a week, just given the exposure that they have. But then you have people who are working in corporate settings where they're working remotely. You're probably not going to test unless you're symptomatic. So it really is based on a case by case basis. But I would look at kind of the personal exposure that you have, how frequently you're out there, how often you're interacting with people. It's a judgment call, but I would say people in those high risk professions should probably be testing 1 to 2 times a week.
And it's interesting. I feel like you guys are on the cutting edge of something, especially when I go back to this at-home testing and for people that have to do emergency travel. We know you don't plan for emergency, and to make sure that you're safe and not exposing anyone unnecessarily. So let's talk about this at-home test. Is it a do-it-yourselfer, or how do you explain what's the difference in at-home test versus do-it-yourself test?
That's a good question. So a do-it-yourself test, basically you're following instructions, you're doing the test by yourself, and certain tests have certain FDA authorizations to do that. Our test isn't a do-it-yourself test. It's an at-home test, which comes with supervision from a medical professional. And so they will supervise the steps, you taking the test. They'll make sure you're doing it correctly. And in our experience, most people actually prefer that. The supervision, just having that added comfort that you've got a medical professional who is looking over your shoulder and making sure you're doing the right thing. Not to say that the do-it-yourself test is bad. It's not. It's a pretty simple test to take, but it's a matter of personal preference. But I would say 90% of the people we test, they prefer that. They like having. There's just some comfort knowing that you've got an expert making sure that you're not going to mess up the test.
How accurate is this test, where your take-home test that's being provided?
Yeah, I'd say it's over 99% accurate. And here's the reason why. When you look at the PCR test and you look at these other tests, the PCR test, I don't want to get too technical, but
Right.
it's a polymerase chain reaction. And basically, in simple terms, what that does is it amplifies the DNA in the virus, amplifies it to a level that can be detectable, So it's just basically copying over the DNA over and over again. So then you can actually have a more accurate test because you're testing the real thing, but it's just been amplified. The other test, like the antibody and the antigen test, it's just detecting the viral load. So if you have a small amount of viral load, it might not get detected. And so those other tests, you're more likely to see false positives and false negatives on those other tests just because of the technique. And those tests are trying to detect the virus at the lowest levels. But the PCR, you're basically amplifying the genetic code in the virus and testing that. And so that's why you're going to have a more accurate result with the PCR. And the PCR is considered the gold standard. If you test positive with an antigen test, your doctor is probably going to order a PCR test to confirm that your positive is really a positive.
Well, 99% is pretty remarkable, and there's some people watching and listening right now, probably like, "Oh my goodness." That right there, to be able to test at home and as frequently as being recommended is something that I would think would have some people kind of sit up and take attention. But one of the things they're probably curious about as well is about insurance and the cost. So, can you answer that for us?
Absolutely, absolutely, Tony. That's an excellent question. That's the first question we get when customers call us on the phone. How much is the options here? For travel, that's discretionary. So people are going to pay out of pocket for travel. And if you go on our website, globalvillagehealth.com, our test is $129. That's shipped to you overnight. You take your test, it's overnighted back to the lab, and then the 24 to 36-hour guarantee is on that. There's another option that we probably it'll be ready next week, but we can bill insurance. So people who have insurance can get the test. There'll be a small copay, but it's essentially covered by insurance. And then, we are even testing Medicaid patients too as well at a couple of medical practices that we brought on. So we have the ability to bill insurance, but if you're traveling, you're most likely going to come out of pocket.
So globalvillagehealth.com, David, and hopefully people aren't like kind of shying away when they hear costs, especially with the tough economic challenges that they have. You said possibly another option still to come, and I wish that we could really kind of elevate this whole concept and put it on blast because I love the idea of in-home testing, and you guys are very knowledgeable. So, what are the plans? Like, where do you go from here as you continue to get the word out about what you're providing?
Yeah, I mean, we're trying to do things outside of the box. We're trying to do things unconventionally. So what we want to do is make testing more widely available. We're in talk with manufacturers in terms of stocking our test kits in vending machines. We're in discussions with airports. Still early stages, but we want to be a household name nationally, and so the way to do that is to make the testing available, make it more convenient in terms of getting the assistants to take the test, the ease of buying the test. And so we're just focused on growth and trying to get the word out there. But we're exploring a number of avenues in terms of distributing our test more broadly.
It's been great talking to you guys leading up until this point. And again, you're on site testing 8 a.m. to 3 p.m. at Still Creek. And I know also over in Harrisburg. And we are scrolling the information across the bottom. In addition to that, globalvillagehealth.com. Is there anything else you would like to share as we start to wrap things up?
Yeah. So just kind of words of wisdom. People, we're in a pandemic, but help is along the way. We've got the vaccine coming. Testing is still important even when you get the vaccine because we need to know that the vaccine works. So it's critical. If you suspect that you've been exposed, get tested. There's a lot of power in knowing where you stand, whether you've contracted the virus or not. And so, we just encourage people to get help. If you suspect that you've been exposed, get help. Don't sleep on it. And help is on the way. This thing is definitely going to come to an end. But we just got to be prepared to take those steps.
Global Village Health. Hey, David, I would say our question of the day, how can we safely travel during a pandemic? What would be your response to that? That's what we've been asking everyone.
Sorry, could you mind repeating the question?
Yeah, I hear the phone ringing. How can we safely travel during a pandemic? My thoughts is we'll probably start by taking your test, right?
Yeah, you probably should. But, I think, I think your guest came on. He made some pretty good points. Try and travel in some, off season, because you're going to have the national holidays like the Memorial Days, July 4th, and everybody's going to be traveling. I think it's strongly recommended that you kind of pick a time that is really off season for most people. Take advantage. Most people are working from home. We also recommend also just driving, do a road trip. The only exposure you're really going to have is the people in your family. So the trends are, and then, it's a judgment call, but I think, picking the right season to travel in terms of the off-peak travel is important. I think, road trips, you can still do the road trips.
And there's still
I
lots
think
of
you just have to be
fun.
pretty strategic and very deliberate. Yeah,
Well,
yeah, exactly,
as I was
exactly,
saying, road trips are still
exactly.
lots of
I'm
fun.
actually trying to.
GlobalVillageHealth.com, guys. David, thank you so much for joining us. I didn't say his last name because I didn't want to mispronounce it. I know it's David Bioke Danquoya.
David Danquois is fine.
Danquois. Okay.
Yeah,
Well, I
yeah.
tried. I wanted to take a shot at it. Thank you so much for talking with us. GlobalVillageHealth.com, 704-654-8511. It's certainly been a pleasure. So thank you so much for taking the time to talk with us. And thank you to our producer. Absolutely. And thank you to our producer, Amelia. A lot of things happen behind the scenes, folks, that you guys have no idea. I discovered one of my lights went out, one is peeking on the side, but we just keep pushing ahead. We appreciate you all hopping on. Erica Simonton Beatty, always on with us as well. Thank you so much. We were trying to get more response from you for our question of the day, but the conversation continues, even though we hop off. Do you think it's safe, and can we safely travel during a pandemic? Again, thank you to William Campbell of First Care Medical Clinic, as well as David. That's the best I can do with Global Village Health until I practice and pronunciate his name, pronunciating his name, that is. I'm going to wrap things up, folks. Again, we'll be back on Wednesday. You can join me on Sunday morning, Sounds of Inspiration, kicking off at 7 a.m. Inspiration and information. It's Canceling COVID together, as you hear from all of our guests. Real talk, great information, but we're in this together. We are going to cancel COVID. As always, life challenges make you better, not bitter. I'm Tanya Rivens. Have a great weekend and be safe.